Welcome back to Digital Health Vitals. We are discussing all the hottest news in digital health and especially AI in healthcare, and a few announcements and updates. First of all, it took us a while, but finally we are on Spotify and Apple Podcast. So if that's the platform that you're using for listening to a podcast, we'll leave links in the description. Please subscribe and follow us there. Two, we're just 50 subscribers away from our first milestone, which is 500 subscribers. So let's make the push. Help us spread the word. Share this video with your friends and colleagues in health tech, and let's help us get to our first milestone. We traditionally have our crew, Sergei Polevikov and Ben Schwartz, with us. Rick Renard is still busy deploying some really cool stuff in AI in healthcare, but hopefully we're gonna get him back in March, and we might have another edition. Um, but no spoilers yet. We'll keep you updated. So let's get to the news. The first one, and actually I want to discuss, and I didn't tell you about this before, so it's a surprise. And Sergey, mostly for you, because I feel like your addiction to TikTok and all the social media is going crazy. So I want you to see this news. So thanks to Nicolas Fabiano, he brought this to our attention. Addiction to short form videos reduces brain activity in the frontal lobe, weakening the ability to focus. So basically the whole article is saying we're getting dumber and dumber with social media. So Sergey, we need you being sharp, we need your brain. So please stop using TikTok as much as you do. And obviously I'm being sarcastic. I was the one who found this use on YouTube Shorts. So I feel like this is a problem for literally millions of people out there. It's now scientifically proved that we're getting dumber and dumber because of this short-term video. So let's work on this and limit this time in any possible way. Sergey, you want to comment on this?
Yeah, if that's the case, turn off this video right now and do something productive. Yeah, I don't know where you're getting your information. I'm not addicted to TikTok. I don't think so. But this is what any person who's addicted would say. So yeah, maybe you're right.
Ben, do you have TikTok on your phone?
I do not have TikTok on my phone. I try as hard as I can to avoid short term video. Unfortunately, if you use any social media platform, it's almost impossible in this day and age. And oftentimes, like everybody else, I find myself sucked into it unintentionally. And then eventually I kind of reach the point of why am I looking at this? I feel like I'm getting dumber while I'm doing this. And then I've made a conscious effort to try to read more. I can't, books, but I can't say I've been super successful.
Well, let's all try to follow Ben's example.
Yeah. By the way, I agree with Ben that the less you spend with social media, the better off you are. Unfortunately, in some businesses you have to be on social media, so it's like you know but yeah, in general, if you can stay out of it, I think you're better off for your mental health and just for perhaps everybody around you, including your family. So I totally agree.
Yeah, there's actually another podcast I like to listen to called Aperture. I don't know if anybody's heard of that, but they covered this very topic recently. Are we getting dumber? And scientifically, yes, we are as a society, civilization, globally, getting dumber for a number of reasons. So if you're interested in the topic, I would recommend checking that out.
We'll add a link to that. Obviously, we don't want our viewers to get dumber, so let's listen to that podcast as well. All right, let's get to more related news to our topic. Sergey, you brought this up. A war for words between the authors of the Guardian editorial and Spencer Dorn on whether something is better than nothing in healthcare AI. Tell us more, Sergey. Lead us through this fun discussion on LinkedIn.
Yeah, thanks. The Guardian basically had an editorial where they made a point that look, it seems to them, to the authors, that there's this divide is happening, this diversion between perhaps low income and high income folks in terms of you know I, I think their point in general, like access to healthcare, but in particular the AI helps enhance this divide because they're saying it seems like AI is after this kind of like cheaper version of healthcare where all low income people is going to be using AI, and if somebody with money actually will have access to actual human doctors. So this is kind of like, I'm kind of simplifying, but this is, in my view, when I read it, this is kind of the gist. So that's one point, and then another point was that look, you know, people who are low income, it's actually dangerous to, I guess, I mean, especially right now because we don't have completely, safe AI tool that would work independently of human doctors with the patients, and so they're saying it's dangerous to essentially promote such tool under any circumstance. Um, and so, I mean, kind of valid arguments, right? And then Spencer Dorn basically said, well, yeah, but there are like nuances there because there are situations where, perhaps AI is getting so good. And he mentioned, I don't remember, but the couple of companies that, it's better than nothing, essentially. So if there's somebody who ordinarily wouldn't have access to medical care, and he kind of continued the story of homeless people that the Guardian editorial brought up, basically saying, look, homeless, they they usually end up in AR when it's like a very extreme dire situation, but otherwise like wouldn't be nice for them to at least have something, maybe not only homeless but just low income, I guess, people in general. And then they started this debate basically, which was kind of interesting on LinkedIn. So this is basically two sides of the story. Um, is AI better than nothing? Uh, Actually, I wouldn't just say low income people, but just for anybody, for example, who doesn't have perhaps access to healthcare, or should we just deny that access because for the argument that it's just too dangerous right now to even think about it? So those kind of two stories, two opinions, and I don't know.
Which
I don't
side?
even know where.
Which side are you on?
Yeah, it's a good question. I don't even know because I was thinking about it, and because both are really good arguments, and but the argument that, look, we shouldn't let AI just operate autonomously. We have to wait for a doctor. I don't know. I think there are certain situations, even in this great country, you can think of like rural areas or underserved populations where there are situations where a doctor is not available, like even like where I live, like sometimes you're on the phone and like waiting for help. So I think at some point, I don't know if it's right now, I'm not going to argue it, but AI is getting better, and so to have some validated and tested AI tool that would help you perhaps with non-critical questions, as opposed to not getting anything. Because again, the choices here are kind of like the editorial saying, no, 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 we have to wait for for human doctor. It's just too dangerous. I mean, but the Spencer's argument is that, well, but there are situations where doctor is just not available, and so I think both of them are kind of right. But I would argue that yes, if there is like a rural area and you cannot get anybody on the phone, but you can get that AI that's validated and safeguarded. I would argue that's better than not have anything. But again, that's kind of my view.
Well, Sergei not taking sides, so this is something new. Ben, what's your take?
I think it's a complicated issue. I think if AI can be used to improve access and do it safely, I agree something's better than nothing. Could be worse than nothing if it's not, good advice, or it hasn't been vetted or hasn't been proven to be safe. So there always is that possibility. There's always the concern that what kind of infrastructure do you need to even be able to access tools like that, be aware of them, be aware that they exist, have internet access, those types of things you have to consider as well. whether or not people want AI to be their doctor or not. I think we tend to get in this echo chamber because we're in this sort of, we're interested in this kind of thing, but and most people are aware of AI, but maybe not to the degree that we tend to assume, in these circles, because we are. So I mean, I think there's a lot of moving pieces. I think there's the other end of the spectrum too, of like, the very wealthy and sort of investors who are really pushing this idea of an AI doctor, AI healthcare driven world, is the other end of that spectrum of, look, doctors don't know what they're talking about. They're too traditionalist. I'm looking for, a higher level of input, and AI is going to give that to me. And if I never speak to a doctor again, I'm happy with that. And I think there's definitely a class of people that feel that way too, but a lot of them, at least in my impression, are on the other end of the economic spectrum. And the other thing is, we don't. It's so hard to kind of separate out what is AI hype versus reality at this point that it's almost impossible to know, you know, to pick a side at this point, as far as I'm concerned.
Yeah, I would agree. Spencer actually, when the debates started, he started like arguing and giving examples like this Akira Labs. They're saying, well, they actually develop a lot of safeguards and it's tested and safe, and they have the what he calls a street care model for this kind of situations. But I agree with Ben that, like if I'm a medical professional not familiar with all these models, like how do I know what I'm actually using, what I'm buying? And unfortunately, as I've been writing in my work, there are so many examples where just, fly by night players kind of made it so much worse, for the rest of us. And so, understandably, medical community is now very, very cautious about this kind of tools, this kind of developments. And so, I mean, it's an interesting scenario. Again, in my opinion, AI is going to get better. I think it's an interesting discussion to have. Um, and safeguarding any patient, whether you're low income or high income, that's the most important thing. But I think we're gonna get there.
Okay, since no one is taking sides, let's give time the opportunity to decide. After all, all right, let's move to our next news. Carbon Health has filed for Chapter 11 bankruptcy as part of prearranged financial restructuring aimed at recapitalizing the company or facilitating a sale. Um, Sergey, you love this news about bankruptcies in health tech. Uh, have you done a deeper dive in what happened to Carbon Health?
Yeah, full disclosure, I'm looking at it right now. I'm talking to people inside the company. So very interesting development. I don't know what Aaron Bully, the CEO, I guess former CEO, is gonna think about all of my thoughts here. But to me, it's a let's be honest, it's another situation where instead of, in my opinion, having uh, patient care and medical community on top of your business agenda, it was all about venture capital. So the fact that the company, pivoted so much, started as this great EHR idea, and then like started pivoting basically wherever there's hype and money flows, essentially cash flows, they're moving towards, which is a great way to make short-term cash flow. But like, if you are building a long-term business, I think this is like the worst that could happen to a startup. So we'll remember all of AI that famously did 27 pivots in 10 years, which is basically running 27 businesses as one company, which was crazy. And eventually all this house of cards collapsed. I feel like it's a similar scenario here. They were essentially running many businesses inside one company. They were claiming they're a technology company. I had an article on Carbon Health as part of my kind of predictions for, I think it was 2024. It was actually 2 years ago. So I was a little off, but in terms of direction, I was correct. Criticizing what Carbon was doing 2 years ago, I guess. You know. It's very interesting because I just gave a lecture to Cornell students and I had this slide that I guess we can share like later. But I don't know. It seems to like the more I look at it, the more like there are like certain patterns. Companies very vague about technology. A lot of pivots. Culture inside the company. It's funny. I was writing about this like uh, Aaron Value, who's the CEO, actually was very honest. I thought at the time he had this tweet that he deleted, I guess, later by the advice of their general counsel, perhaps, where he said that every decision we made in 2021 was a mistake. And if you think about 2021, it was all about pivoting against, again, one more pivot to COVID testing, because that's where the cash flows were, that's where the fear was, that's where, you know, the biggest sort of revenue opportunities were. And so all of a sudden, from like EHR and urgent company, they became this all-in COVID testing company, which became 80% of their revenue at the time. By the way, I feel like the same story is right now with all these GLP-1 resellers. Any company that were doing anything, all of a sudden they're now GLP-1 companies. And by the way, they're not even manufacturing those you know, weight management solutions. You know, I hear so many stories. I don't even know if I can share now, but like, you know, the famous prediction of Aaron, the CEO, that they're gonna have 1,500 stores, which at the time was kind of like, first of all, like no one had not stores. I'm sorry, primary care clinics, which at the time no one, and still no one even close to that number, almost like, you know, Starbucks like level number of clinics. And then he comes back to the company, and in the company meeting he says, you know, by the way, I just made up that number. So he tells investors, he tells the public in the interviews, this is where amen. He said, you know what, I don't even have any like any basis on that. It just seems like, you know, a nice big number. And so like this kind of like loose attitude and like culture within the company, they had this, apparently every morning they had this gratitude circle where you're supposed to, for 15 minutes, like say thanks to somebody within the company. And inadvertently everybody started thanking their bosses, you know, which is kind of weird. So I don't know. It all comes back to culture. It all comes back to how you manage your money. It's all coming back like, who are you serving? Are you serving your customers, or are you serving your venture capitalists? And I thought it was, as with so many companies before, like Olive, you know, Watson Health, Babylon, it was all about serving investors, not your customers, not the medical community. And I feel that was like part of the reason that they eventually collapsed.
Before I let Ben respond, I'll give a little bit of more data. Totally, Carbon Health has raised $614 million until today. And there was a bigger C round in November of 2020, $100 million. And then in July of 2021, in their Series D round, they raised $350 million with valuation of $3.3 billion. First of all, these valuations, don't they remind you of some current companies? But anyway, I think talking about patterns, I feel like Carbon Health became a victim, like many other companies, of those super high valuations in 2021 when the money was just pouring crazy in health tech. Like, we're not even close to any of the numbers that we had in 2021 in terms of investments in digital health. And those valuations were just not realistic. Like, the business model cannot produce that much money that they're saying that they will. So I feel like Carbon Health is one of those victims, and I feel like we're gonna see more of those. But yeah, Ben, what do you think?
Yeah, I agree. I mean, I think it's like Sergei said. I mean, they sort of got traction during COVID with COVID testing. I mean, during COVID, every company either became a telehealth company or a COVID testing company or both. Obviously, that wasn't sustainable. We didn't necessarily know that or think that way at the time. And then it was like, are they an urgent care company? Are they a primary care company? CVS put a bunch of money in. In fact, they just they spent, I don't know, a year building Carbon Health location in our local CVS, and I don't think it was open for probably 2 months before this announcement was made. I mean, it looks like a beautiful space. I never saw anybody in there. CVS to me is a place you go in to pick up your prescriptions or pick up something quickly and get out of there just as quickly at the retail locations. Not necessarily a place I would think to go to get primary care or urgent care. There's a whole issue of urgent care, primary care as venture capital backable business. There's the whole issue of healthcare in general. Healthcare delivery in general is a venture backable business because it takes a long time. It's expensive, particularly if you're doing physical locations. The capital expenses on that are great. If you're trying to do primary care, the reimbursement's not great. And then in the whole ZERP era issue, and there are some companies from the ZERP era that are still existing, but maybe can't go public because their valuation, we saw that with Hinge Health, they're never going to match their valuation if they go public. Are they going to be, go public at a down value that's not worth it for, their latest investors? So, a lot of issues that sort of Carbon Health is emblematic of in healthcare investing and healthcare innovation.
Yeah, I mean, actually, if you believe their financials, which again, it's another issue. You can never even know the numbers exactly. I do know they never made any profits. It's all about like revenues. But even revenues, I mean, it was actually compared to all these other cases that I mentioned, like Hippocratic and Communal and Open Evidence. I mean, if you believe the revenue numbers, this actually maybe wasn't that crazy. Because I think during COVID that there was one burst that one year I think they had like 260 million or something, which is pretty good if that's the right number. Again, you never know with those guys. Like they don't have to report to the SEC. They're kind of like just claiming something. And after the fact, as with any of these failures, but especially like fraud cases, like Theranos, when you find out that the numbers were not actually the right numbers, the revenues they're like 100 times smaller, which was like amazing. Um, but yeah, it's just this general kind of like, and you're right, it's going to continue because again, who's running the business in the end? It's the VC investors. Um, so there were like I was reading a bunch of articles and LinkedIn posts, and so there's this one company, like a loan writing company, trying to make a difference in primary care, and they're saying, you know, when CVS like started looking for primary care partner at the time, they basically told no to them and chose Carbon at the time, just because perhaps of their VC connections, whatever. Um, and looks like for Carbon, it was just another pivot. With the it's so unclear to me like how serious they were, but it was like similarly a nice thing to say. They got 100 million in funding right away from CVS. CVS obviously eventually ended up with Oak Street, but it's fine. Like sometimes like uh, companies with good goodwill, good ambitions, they're getting bypassed just because they don't have enough funding and not enough influence, and that's kind of sad story of this whole situation.
All right, let's get to our next news. Actually, I started following this company right after Rick Renard doing our predictions episode in December. He nominated this company as his company of 2025. It's Heidi, AI scribe tool from Australia, the one that we don't talk as much in the US. People definitely know other players in the market here in the US than Heidi, but Heidi launches evidence and acquires Automatica to accelerate its AI care partner platform. So I really like their press release. They say that medical knowledge now doubles every 73 days, making it impossible for clinicians to stay updated with new methods and research. While many have turned to general purpose AI, these tools lack transparency and local clinical context. This search engine approach often erodes the perceived authority of the encounter, leading to a profound lack of patient comfort when they feel their symptoms are being researched. They're the same tools they use at home. So some of the features they think why they're different. First of all, they say they have authoritative sourcing. They're ad free. Uh, they also have seamless integration. They also have traceable intelligence and ethically accessible. So they say that high data evidence is free for individual clinicians, ensuring high quality medical knowledge isn't a privilege of wealth. So yeah, seems like they're trying to be like Robin Hoods of healthcare knowledge. no ads, free for individual commissions, and apparently it's a competitor to Open Evidence, Up to Date, Docs, ChatGPT, and others. So yeah, guys, what do you think of this news?
What's the saying? If something's free, if the product's free, you're the product. Oh, yeah, I mean, I think obviously with any of these ambient scribe companies, it's becoming harder and harder to differentiate yourself. Now a lot of them are getting into RCM. This is an interesting pivot, because it doesn't seem like there's a ton of competitors to Open Evidence other than Up to Date, which has kind of been, I think, on its heels a little bit because of Open Evidence, caught them a little bit unaware. Um, yeah, I mean, I've always wanted like a searchable PubMed that you can ask natural language questions to and get, high quality information back that you can trace back. I don't think there's anything wrong with having more competitors in the marketplace. We'll see if it's truly differentiated from Open Evidence. And I think it's probably smart on their part to differentiate themselves from all the other ambient AI companies now that are kind of going more towards the RCM space, maybe not doing something like this, because that's how you sort of lock in, you offering tools that clinicians want to use to lock them in. And I would say most clinicians maybe don't care so much about RCM tools. So we'll see if that approach is successful.
To me, honestly, their biggest competitors are foundational LLMs. Okay, so first of all, I saw that announcement by their co-founder Thomas Kelly, and I asked him a question like what are you doing here? Like who are you competing with? To his credit, he like responded like within 5 minutes. So he said, yeah, I mean it's a competitor to so what did he say? He said definitely a competitor to Open Evidence and Docs GPT. As for Up to Date, we're actually trying to partner with them, which is kind of interesting. I think there's something going on behind the scenes maybe. And I appreciate that in the announcement they said, "Oh, we're actually using Anthropic's cloud technology," which is already pretty honest thing to say, as opposed to like Open Evidence. Like the more I read about them, like the less I'm confident like what the hell they're using like underneath their technology. I mean, I kind of know their data sets, but like in terms of technology, is it a reg? Is it foundational model? Is it combination? Is it your model? Like I don't think they've trained anything. I think it's also was based on some foundational model that just don't tell anybody. At least Heidi says right away, look, it's all powered by Claude. So when I tried to for a couple like I thought it was kind of hard questions. It feels like Claude to me. Like honestly, I asked the same question, Claude. It's almost like exactly the same answer. So that's what I'm saying. Like it's I always thought in the old days it's like, oh, you can fine tune on like clinical data. You can maybe like have safeguards because we're in medical field here, so it's all like HIPAA compliant and all those laws, and maybe foundational models don't have those level of protections. Now we have ChatGPT for health. We have Claude for healthcare. Like all of a sudden they're part of healthcare, right? So I do believe it's not Open Evidence versus Doximity versus Heidi. I think it's honestly like coming back to foundational models. And as I was saying all along, I think a lot of those things they're going to be commoditized. And you cannot spend as a startup even as big as Heidi, hundreds of millions on training those models. So and that's okay. So again, I didn't find any like like interesting in terms of like my line of thinking. Like when I was playing with it, I'm sure there are use cases that you can point out to that kind of just distinguish them from everybody. Anyway, like high respect to the team, but again, we're getting to the point. It's like hard to differentiate between those things, between those tools. I don't honestly like just in terms of the feel of it. I kind of like Docs GPT because first of all, for some reason, I don't know if it's my experience or not, but it's much faster. Like like even like Claude, you have to like well, I guess it depends. Maybe I was using like thinking mode, but you still have to wait like from seconds to sometimes minutes, right? Um Docs GPT gives me answer almost like instantaneous, so it's just kind of weird. And also it seems like more kind of open with lots of links, so I don't know what that's all about. I know like Doximity, they have also like special relationship with like Pathway Medical or something. And so Pathway Medical provide like additional data to all this like common data sets like PubMed, etc. So I know Open Evidence have their exclusive source of data, but Doximity have some. So I'm sure they're different, but like in terms of like my question and my um analysis of, for example, my health, I didn't see that much advantage of Heidi versus Open Evidence versus Doximity.
I agree with both of you. I think it's super hard to differentiate themselves. And to your last point, they also mentioned traceable intelligence. So they provide concise summaries with transparent citations, allowing clinicians to verify every insight. So they're also doing that. So, but yeah, you're right. It's super hard to find differences right now. But yeah, exciting to see. I think more competitors is always better. So exciting what's next. Um, and it looks like Heidi's making a huge push to come to the US market. I just came back from LA from Vive. They had a huge presence. They had a lot of branded cars in front of the convention center. So yeah, the this race is getting more heat every day. Interesting who's gonna end up winning, or many players probably, but let's see what other.
I mean, just to mention, I also right now in the middle of like article and actually ran a horse race between like various LLMs on few, which I think is kind of like interesting clinical cases. So I mean, it's hard to differentiate, but like sometimes it's interesting, like because that's exactly what people are asking about, like tell me what this product is versus this product. So I think it's still an interesting exercise, but like uh, you're absolutely right. Like even for somebody who is doing research in the area, sometimes it's just confusing. I think it's coming back to the fact that you know there are only like a handful of like big foundational models. So you either API in to ChatGPT or to Claude, and maybe a couple of others, but like Gemini. But like outside of that, it's kind of like hard to differentiate yourself, even in the clinical area, which is kind of amazing because in the end of the day, if you can get like all the data you need, like literally world data, and you're that company, if you were like OpenAI or whoever, then you can perhaps build those like niche products if you want. I don't know if they want, by the way, because it's not big money for them. But again, it's interesting. Again, hard to differentiate, but it's interesting that all these products are coming up.
Off top question to you, Sergey. How many articles are you writing at the same time?
There are a few, and I've had a little break because I'm also doing trying to finish my research on venture capital performance in health tech. Yeah, so sometimes it's good to have a lot of things in parallel, but sometimes it's like slows you down a lot because you cannot really focus. And as you say, when I'm on TikTok all day, it's impossible to focus.
That's true. That's true. All right. A new study out of UCSF finds that AI scribes only help clinicians who are bad or inefficient at clinical documentation. Any comments on that?
Yeah, I mean, when I was in practice, I felt I had a pretty good system. I prepped for clinic, kind of had an idea of who was coming in, who needed what. I had templates in the EMR, but at the same time, it was important for me to, not have every note read the same and be useless, templated information. So it was a balance between making sure the notes are personalized, but at the same time being efficient with some templates, and it seemed to work fairly well. So yeah, I mean, look, there's a spectrum like anything else in terms of people's documentation efficiency. Um, but but again, we just need data, right? We need more information. I think the speed of the hype, the way these things moves, that the data just can't keep up with it because it moves so quickly. Now it's trickling out that look, it maybe generates $3,000 worth of revenue per doctor per year, which is eaten into by the cost of it. Maybe it doesn't make you that much more efficient. You got to go back and proofread the notes. That eats into your efficiency. A lot of them don't directly go into the EMR, so you got to cut and paste because they don't directly populate into the EMR. I mean, there's all these things and steps that you think about. So I think they're nice to have, but I think the jury is still out on whether how revolutionary they truly are.
I agree. And the reason I brought it up was because I thought it was like I saw this article, I thought it was interesting. I thought it was more or less clean, kind of randomized sample because if you read the article, it's kind of interesting because they knew there this event date, which was part of the same health system, which is kind of like obviously a limitation to the study, but at the same time, it made the authors build this kind of more or less clean sample because they know the date when Epic would be released in AI Scribe, and they started measuring before that, basically saying, here we are before the event and after the event. So it's this, at least to the extent I guess possible in clinical setting, it was kind of like clean break there, and so they started measuring the work of clinicians before Scribe was introduced and after, because it was like a really clean event. And so it is kind of interesting that, first of all, I, I thought like that if you're maybe slow in documenting, maybe you're also kind of bad with technology, perhaps. And maybe that's the case, but it wasn't really that statistically significant, meaning that, you know, all doctors are actually pretty smart. So when you give them something, they seem to learn quickly, meaning that it was like universal. They introduced the scribe, everybody's like learned pretty quickly. And so it was pretty clear that, if you measure your documentation before and after, they did also measure, pajama time, but that was kind of like unclear. They didn't have much data seemingly. They call it wow time or something. Um, and so both kind of moved in the same direction, meaning that, you were slow with with like your regular data documentation, you were kind of slow than I guess average with your pajama time, and then all of a sudden you had like biggest increase, which tells me both groups actually learned pretty well how to use AI. There was no like major issues, and it's the slower guys that benefit the most, which I guess in that perspective, if you think about it, kind of makes sense. Again, a lot of limitations. Like people, like I published, I had this on some Substack and LinkedIn, and get a lot of feedback from clinicians. People argue that, well, there are all these limitations, and it's how do you even measure, like, pajama time and effectiveness. So a lot of issues. So yeah, you're absolutely right, Ben. We have to kind of like take everything with a grain of salt. We have to accumulate all this knowledge, but it's still interesting to look at the study, especially when they done correctly, from like a scientific standpoint, and we have a lot that are not done correctly, unfortunately. And so, one big argument that actually coming from Rick Renaud, about, um, not this paper, but there was another paper we were discussing also on the effect of AI scribes. He was saying, he was saying basically, well, all of this, a lot of these studies, they look at things like productivity and ROI, and maybe more important things to look at are things like reducing burnout, and also how does this tool improve billing and coding, which is, by the way, this is how AI script companies are selling you their products. It's all about, how good they can capture that billing element, because this is how clinicians charge insurance companies, for example. And so that argument, I think, is important to understand that it's not just about efficiency. It's about, how you provide care. So if the iScribe makes you more efficient and you're within whatever Optum corporation, does it mean that you're just gonna see more patients and all this efficiency kind of goes away, and it just makes, corporation more profitable? Or I actually spending more time with patients and making, their experience high quality. So anyway, a lot of questions, interesting research, and I think we have to like continue looking in this kind of studies.
Because it's an interesting point about, are you comfortable with technology or not, or have you optimized the EMR? People that put the time in to, make sure they understand how to use the EMR, optimize it, do templates, probably are more efficient than the person who doesn't put that time in, or doesn't realize that those capabilities even exist. And the other thing I always think about too is, are we just creating technology to solve the problems with the bad technology that came before it? If we just had EMRs that were better, would we need ambient scribes as much? If we didn't have EMRs at all, the bad EMRs that we have, because pajama time didn't really exist whenever 20 years ago, it's kind of a function of poorly implemented EMR technology. Those are interesting things to talk about. Are we better off fixing the core problem rather than just layering more technology on top of it? I think is an interesting thing to consider.
Oh, this is great. Every episode we discuss a new study that comes out about AI scribe tools, and one potentially contradicts another, but this is fun. We'll definitely keep following this. All right, the last one for today. I really want to bring this up, and thanks to Eric Brandon, our board member, Health to Tech, who shared this tweet, or X, whatever it's called. Cardiologist wins third place at Anthropic's hackathon out of 13,000 applications. The guy builds in 7 days. His name is oh man, Michał Nedoszytko. Coded day at night in a hospital in the cloud while flying from Brussels to SF. And the project is called Post-Visit AI. So yeah, I just want to discuss this real quick because I think this is fascinating. Healthcare providers didn't have this opportunity to build something in 7 days and like something meaningful and bring it to actual users without all this vibe coding assistance and cloud generating assistance. So this is exciting. What do you guys think?
Yeah, I think it's really cool. Unfortunately for him, his health system probably owns the IP on it, but um, yeah, I mean, I think it's physicians, and there's more and more of them that are interested in this type of thing. We'll build some really cool stuff. Um, I've tried to dabble in some vibe coding myself. Maybe I'm not doing it right, but it seems to me like you still have to have some degree of coding experience and expertise. In order to make it work. I think that will probably get better as the tools get better as well. But
Which tool did you use, Ben?
I just took an online course to kind of dip my toes in. It was a Google course using Gemini. It was like the vibe coding part of it was just typing into a prompt like you normally would, and then the rest of it was like setting up Firebase and cloud accounts and stuff like that. And not super hard, but at the same time, as far as I could tell, it's not quite as simple as, hey, just fire up some tool, tell it what you want to build, and it's going to magically be this wonderful thing. But yeah, it will probably get there closer and closer to that at some point. But I mean, it's nice that physicians can take back some ownership. They have tools to build themselves, to build things that actually make sense for them in the clinical setting rather than what somebody who's never treated a patient thinks is going to work.
Sergey, are you a vibe coder?
I'm a vibe coder, yes. But I was gonna say that I totally agree with Ben that it's a good development. In fact, it's funny. Like some of the best coders I've met, they're actually doctors, which is unbelievable. Like some of these doctors, like they have these hobbies that become sometimes like really great expertise, which is very interesting. But I think in general, it's good to have clinicians as leaders in some of this health technology and health AI companies. And so, yeah, absolutely. The more people like that we have, I think the better of this industry is.
Makes sense. It's a cardiologist. I mean, they're used to dealing with data and reading EKGs. Orthopedics, we just try to fix things with hammer and nails. So we're in the garage building cabinets, not vibe coding. Probably I shouldn't say that because there's some pretty notable orthopedic surgeons that are vibe coding. But
Actually, no, a lot of dentists for some reason are also real estate developers. Like, what the hell was that?
All right, gentlemen, another great episode. As a reminder, please subscribe to our channel. We are recording a few fun interviews in March, and we'll definitely have another episode of Digital Health Vitals. Maybe with some new guests, maybe not, who knows. But yeah, great stuff, exciting times, and thank you so much.